In this course, you will be required to complete case studies in order to be qualified for your NAHA certification. For the level 1, you will be required to complete 5 case studies. And for level 2, you will need to complete a total of 10 case studies. So I want to take a few minutes to go over how to perform a case study. All right, to begin, you want to perform an interview. This can be with you or your client. It could be with a friend or just making it up for yourself. Now, you're going to be using your Aromatherapy Intake Form, and this is in your workbook. So we're going to look that up here. You'll find this on page 110. And there's lots of forms here. Don't be intimidated by that. I know it looks scary, big thick book like this, but I've given you plenty of forms that you can use for both levels, as well as maybe down the road you might want to use these for your practice. So you're going to be gathering information in an interview either by phone or in person, or you might even use this to email to your client and let them fill it in. I always like to have a face-to-face with them because sometimes while they may enter all the information in, after I've taken a few minutes to look it over, I'll ask more questions to probe a little deeper into some of the things that they mention, because they may not be thinking about those things, but you can also draw it out of them a little bit and maybe add to their notes. And that's when you're going to want to pull your aromatherapy clinical practice intake notes out. And this is on page 114 of your workbook. So in this, you're going to be using this form to help you gather all that information that you got from your interview with your client, and you're going to use this to guide you as you're choosing those oils. Now, you'll be gathering information about the profile, the lifestyle, maybe some of the treatment plans that you have in mind, because you're going to be looking at those particular conditions that they mentioned during the interview. Okay, so you're going to want to make some detailed notes now after your interview so that you can determine which oils may benefit this client. And you're going to be using your Aromatherapy Clinical Practice Intake Notes Form. And this is in your workbook. Next, you're going to want to get to forming your blends. And this will be page 320, the Apothecary Notes Form. This is where you're going to really get to have fun, because now that you have your client, the first thing you want to consider is, what is the purpose of this blend? Is it for aromatic purposes, or is it a therapeutic blend that you're looking to make? What are you hoping to accomplish with this essential oil blend? You're also going to want to take into consideration the effect that this blend may have. Is it to reduce swelling? Is it an antiseptic cream for maybe first aid? Or is it maybe a calming diffuser blend to help someone sleep at night? Those are the things you're going to be looking for in helping guide you as you make your blend. Now you're going to need how the blend's going to be used. Will it be in a diffuser? Is it going to be in bath salts? Will you be using it as a body lotion or a massage oil? And so on. So you're going to need to think a little bit further out in how it would be the most effective for that client based on the target area that you're looking to reach. Remember to go back to some of our notes and lessons, look at how the oils get through the body system and which areas you want to target. Okay. Next, you're going to want to look at, is this being used for an elderly person or is it for a child? You want to take into consideration the person's age and their health, as well as whether they're male or female. And those are some of the considerations you'll need to think about when you're determining the dilution rate. Because if it's a facial cream, we want to use a 1% dilution. If it's for everyday use, we may use a 2 to 3 dilution. Also, you want to mention to the client how long they're going to be using their blend. So we have a place here where you're going to need to write that down, whether this is for acute treatment or is this a health condition, something over time. How many times a day are they going to be using this blend? And what is the duration? Will it be for 10 days, a week, 2 weeks, and so on? You also want to let your client know how to use the blend. So you're going to be making notes and you'll be giving that to them with the blend. And so you might say 3 to 6 times a day, for a chronic complaint, or you might say 6 times a day for acute condition. So we have 2 questions here where you'll be writing in that. You also want to look at some of the therapeutic properties of these oils that you're going to be using. So you might want to pull out therapeutic blending with essential oil and look in the back based on the condition and which oils are the most beneficial for that. We also have a section for each therapeutic property, for instance, antibacterial or antiviral, so on. So you want to look at that. Are there any other precautions and counterindications that you need to be aware of? This is the place you want to write that down. Do they have high blood pressure? Are they a diabetic? So you want to make a note here. And you're going to be looking at the dosage of oils. Are you using 15 to 18 drops? Are you using 3 to 6? So we want to write that down. And we also want to pay attention to the carrier oils. We want to make sure that we note those that are the best, those will be the most beneficial for this particular application and how you're going to blend it. And then you're going to use this information as you begin to do your blend. Now, based on whether or not it's an aromatic blend, which would be just something based on just aroma, and that would be in the case of if it's an emotional blend, something for depression or anxiety, you want to make sure it is very pleasant. In that case, you're going to want to refer to your form for your aromatic blending. Okay, so we have 3 forms in the front of this that we're going to be using. So we have our aromatic blend form that you'll be using for writing down each drop that you add to your blend. So you want to have this with you when you're doing your blending. You're going to write down how many drops you use because you may need to do it again and add, refer to this later with your client. Now, if it's just strictly a therapeutic blend and you're not as concerned about the fragrance, then you're going to want to use your therapeutic blend form in your book, and this is on page 32. After you've done this, and you've had some time, your client has been using the product for about a week or so, you want to follow up with them. And this is when you're going to fill in your recipe report form. This is on page 58. Here you're going to be writing down the name of your product. Did it work? If it was aromatic, give a little bit of description. How long did it take to make this? These are things that you want to know, as well as how often did they use it and was it effective? Because you want to make some final notes. Maybe you want to tweak that recipe a little bit and work on it. So those are the forms that you'll be using in your workbook. And you want to have that with you when you're doing that. There's lots of extra forms for you, so you can certainly continue to use this after you finish the course and on into your own business. Now, after you've completed all your forms, I would like you to email them to your instructor. We need to have record that you did complete your work, and so you'll need to either just scan them in to a computer or just make copies and mail them to us, and you can do that directly, just email them to us. Now, keep in mind this information is private when you're working with clients, so you want to respect that. Certainly, you are able to just mark through the name, the age, and things like that if you don't want to share that information with us. But we want to have record of this. So all of your forms here are in your workbook, and you have more directions in your textbooks that you can refer back to. So if you have any other questions about how to perform a case study, please feel free to email or text message me, and I'll be glad to get back to you.